Hello, I'm Dr. Christoph Martschin, a dermatologist from Portugal. Healthy, radiant skin is a request for many patients, and it is the result of several skin aspects being in balance. And whereas there are great validated scales out there that look at individual factors like pore size, wrinkle depth, redness, pigmentation irregularities, we were feeling that we were lacking a scale that holistically looks at all these factors, balances them, and allows us to decide where to start our patient's treatment journey to enable them their best skin. Let's have a closer look at the skin quality scale. We brought together experts in the field of dermatology, plastic surgery, and aesthetic medicine to figure out what aspects contribute to radiant, healthy-looking skin. 4 main categories were identified. Skin texture with the subcategories pores, lines, and scars, followed by discoloration with the subcategories of redness, pigmentation, and dullness, followed by hydrolipid balance broken down into areas of dryness and areas of oiliness, and last but not least, skin firmness. Each factor can be assessed individually from 0, meaning the ideal condition, or not contributing to the patient's concern, up to 3, which means it's severely contributing and is a condition that certainly needs to be part of our treatment strategy. After assessing each part individually, out comes a radar chart that usually, like a compass, points in a distinct direction or 2 distinct directions, making it clear where treatment priorities lie and enabling us to offer the patient a personalized treatment plan. Let me show you how I put this in practice. The skin quality scale is an incredibly flexible tool. You can either hand it to the patient before the consultations to have her fill it in to get an idea of her concern, her perception of her skin situation. Or you can do this together in a conversation, together defining priorities for the next steps. Today I have with me Larissa. Larissa, what brings you to the clinic?
Well, so I just turned 40 and I live in a very hot and sunny country. So far, my main concerns were about texture and pigmentation, but I'm feeling my skin is changing. So what can I do about it?
So let's have a look at different aspects of your skin to offer you a personalized treatment plan. First, looking at Larissa's skin texture, we can see that in the T-zone, she has a bit of enlarged pores, which is uncommon in a skin type 1. However, living in a hot tropical country, this is absolutely appropriate. So I would grade her pores a 1.5. Now, the next textural aspect looked at lines. We can see fine lines appearing in dynamic areas of the face, around the eyes, and on the forehead, as well on the lower cheek during smiling. All in all, I would say it's still fine lines, so on the lower part of the spectrum, I would give it a 1.5. So, the next factor is scars. You were telling me that you were suffering from acne as a teenager.
True.
But luckily had good dermatological intervention and are not suffering from scars as is sequelae. So, discoloration. You already mentioned some pigment irregularities, and I can see that in sun-exposed areas of your face, in a symmetric pattern, you have a mild hyperpigmentation, which I believe is both sun-induced but also has a hormonal aspect. So I would give the pigmentation here a 2 on the scale. Now, we do know that patients with a skin type 1, very fair skin and light blonde to reddish hair, tend also to have facial redness. This is not the case for Larry, so I would grade redness a 1 the most. We can see a bit around the nose, but generally not an issue. Dullness. So what I hear from you is you feel your skin is no longer as radiant as it used to be. So, and I agree that there is some change in the way it reflects light, so would grade dullness as a 2 on your scale. So now moving on to the hydrolipid balance of the skin, areas that either produce too much oil or areas that are lacking hydration. And again, we can see typically in the T-zone on the forehead, around the nose and the chin, increased oiliness, whereas the areas of the cheek are rather dry, and this is also where fine lines start forming during facial animation. Now, skin laxity. Larry, would you mind pinching your cheek for me? You have excellent skin firmness, but we also know that you've had treatments for sculpture in the past,
True.
The original regenerative biostimulator, so your collagen and extracellular matrix are on top. Now, having a look at your skin quality scale result, I would say that your priorities lie in textural aspects, the fine lines and the pores, discoloration, the hyperpigmentation that you have in some areas of the face, but also balancing your oiliness and dryness that you have in particularly the cheek area. My recommendation for you would be at home using a skincare regimen that offers you a mild way to take off your makeup and your sunscreen, but also a good hydrating product that repairs the skin barrier to reduce signs of sensitivity, for example, Cetaphil range from the pharmacy. Additionally, I would like to offer you an injectable treatment based on hyaluronic acid resin skin booster Vital.
I love working with the skin quality scale, communicating with my patient their priorities, their needs to identify a personalized treatment plan. But I also use the scale along the way to reassess at every visit to see how far we have come and where we need to go from here. I call it my compass that guides me along the patient's journey to ideal skin.